My name is Tyler Brannigan. I'm a psychologist with the Department of Psychiatry here at the University of Colorado, Denver, and I work with the psychosomatic psychiatry team, which rounds in the University of Colorado Hospital and on the inpatient side. And then we also do a little bit of work in the outpatient clinics. And so it is a team of psychiatrists that work with patients who have been admitted for medical reasons to the hospital, but then also have co-occurring psychiatric issues that either emerge during their stay or maybe have pre-existed and preceded their stay in the hospital. And so with that team, I'm assigned to cover the transplant unit where we do evaluations for patients prior to transplant, but then also what's more maybe pertinent to minor rotations is the burn ICU. And so the burn ICU is an intensive care unit in the University of Colorado Hospital, and it's also the only regional American Burn Association verified intensive care unit, which means that we are able to treat very intense cases and very difficult cases. So we are more or less a magnet for patients who are very severely burned regionally, which includes Nebraska, Wyoming, Kansas, New Mexico, and then obviously the entire state of Colorado. So it's not uncommon that at any one time we may have patients from a variety of different states because of the complexity of their injuries, and we're able to treat them. The other part about being a verified burn center is that we have a full staff that is able to, multidisciplinary staff that's able to treat the difficult cases that we work on. And part of that is that we have a psychologist, which would be me, and for anyone interested in a minor rotation, that would also include you. And so how psychology fits into the burn ICU is that really I like to think of it as being an integral part of a team, and also an integral part of a psychosocial team that includes a social worker, a nurse case manager, and a chaplain. And the reason why I say a psychosocial team is that really these are going to be multidisciplinary team members that you coordinate with to identify patients who may have a psychological need while they're staying in the burn unit. And then also that you may be able to work with the team to help ease the medical care that they receive. So how patients come to the burn ICU is really a variety of different ways. So obviously, as the name implies, they may be severely burned in an accident. Occasionally, the events that lead to their burns are intentional. So we do have some patients who have self-immolated as a suicide attempt. And so obviously, these are going to be cases that we'd be working very closely with. And then also too, in the winter months, we frequently treat patients with frostbite, which is a really important and busy time for us. And typically patients with frostbite are typically homeless, and they may also have pre-existing mental health conditions or substance abuse conditions that you may be working and interfacing with the multidisciplinary team to address. Also, we occasionally will work with patients who have severe skin infections, and the burn team is very adept at treating these because of the skill of our surgeons and also the intensive care nature of our unit. And what that looks like is that sometimes people derive or have a skin infection due to IV drug use, or sometimes it is unrelated to any mental health condition, and that they can be a very healthy, happy person one day and then suddenly have a very severe skin infection. And in those cases, you may be working with them to ease their adjustment. And the adjustment is two things. One is to just the injuries themselves, but then also too that in the case of very severe burns or injuries, sometimes these patients are on intensive care units for months. And so in that case, a psychologist is really essential in the ways that they are able to ease care, not only for the patient, but then also to interface with the staff to help communication, to facilitate quality of life for our ICU staff, but then also too for the patient. And that's really important when you have a patient who, we've had patients who've been on our unit for about a year. And in cases like that, you know, these aren't roommates that you choose, and so sometimes things can come up, and you're really going to be an important staff member to help staff dynamics with patients, staff dynamics with other staff, and then patient dynamics as they work with multidisciplinary staff and go through really painful wound care, physical therapy, occupational therapy, respiratory therapy, multiple surgeries. All of these things are going to be a very difficult process that as a psychologist we're able to provide interventions to ease that process for them. So as far as prerequisites, you don't necessarily have to have experience working with burn patients. You don't necessarily have to have experience working in intensive care units or even with inpatient patients in a medical care setting. You could have outpatient experience. For example, I was trained primarily in college counseling centers before taking this job, and I really found that it's both a value to have an outside perspective, and also too that it sometimes can be a steep learning curve, but also a really valuable learning curve too, as you learn about all different types of medical conditions, the complexities of those medical conditions, the variety of medications that our consultation liaison service and through psychiatry provides, and then also to how to work in an interdisciplinary nature with the team. So as far as prerequisites go, don't worry too much if you have an interest in working with burn patients or very severely sick patients. Then the burn ICU may be a great option for you. The other thing to think about too is that any inpatient patient is eventually and with great hope going to be an outpatient. And so you would get to really experience and understand what it's like for people who are very sick, what it's like during their stay in the hospital, which itself can be traumatic at times because of the number of surgeries and the painful wound care and all of those things. But then you can understand their perspective and understand what it's like for them to have been ill for so long, and even if you have an interest in outpatient care. So as far as workload goes, the burn unit, because we work as a consultation service, we're very often following some longer term cases, and then we have new admits every day. And so we'll be working with the team to address the site concerns of new admissions, and then also to work with, let's say, the caseworker staff to help those patients get psychiatric services that they need upon discharge. So the typical caseload and workload varies. As a supervisor, it's not my philosophy to overburden trainees and to use them as workhorses. I think that undermines the learning process. And instead, I think of working together with an intern to understand what are potential learning objectives for them, and to meet that need as opportunities arise in the burn unit, but then also too that life is a learning process, and I really value that, and so I'm always learning. And I would say that the only real prerequisite would be that any intern should have a strong sense of curiosity and a hope to really draw a growth experience from their time in the burn ICU. So the typical experience can be very different. So some days we walk onto the unit and there are multiple new admissions that we need to do quick bedside assessments to come up with medication recommendations, and we coordinate with the psychiatry team to do that. We also discuss different intervention plans to meet the patient's needs and also the staff needs. And then also too, we can also do ongoing therapy for some of our longer term patients. So the typical experience is that it's very much like an intensive care unit. So you're going to have all the sights, smells, and stress of an intensive care unit. And I think that it's going to be something to take into consideration. It does require a little bit of a strong stomach to be able to work with patients who in some cases are burned on 80% of their body or having multiple surgeries. And that would be something to consider before applying. And also too, I'm happy to show people around if they're considering working in an ICU. I'm happy to bring you onto the floor and have a discussion with you about whether or not this might be the right experience. The types of patients, we work with anyone who has been, like I said before, meets our kind of diagnostic criteria, which often means that we are a large catchment, especially in the winter months, for the homeless population here in Denver because of frostbite. And then also too, we just work with a broad spectrum. So many times that includes many diverse populations from our large immigrant population, refugee population here in Denver, but then also to rural populations from our surrounding states. Types of patients and cases that we see can vary from people with delirium and trying to stabilize them and working with the team to coordinate recommendations to use delirium, people who are actively psychotic, people who have a strong substance abuse history either prior to admission and are currently in recovery, or very active stages of substance dependence. And we also work with, I would say, people who had no prior diagnosis, but instead they were exposed to a traumatic experience that led to their burns. And so if you have a strong trauma interest, this is going to be a great population for you to work with. We use the acute stress disorder scale because we actually are able to capture a patient population as they meet the criteria for that acute stress in the first month following their trauma before they move into more of a post-traumatic stress response if their symptoms continue. Theoretical orientation, personally in my private practice, I'm more dynamically oriented, but that may slip out in some of my conceptualizations of the patients, but these are bedside quick assessments, quick interventions, and so that doesn't typically lend itself to analytic work. And so theoretical orientation is often integrative in a technical sense, and then also from a theoretical sense. My philosophy is to take what the patient gives me and trying to understand this specific person and this specific circumstance. And so I welcome people from a variety of theoretical orientations because we never know which patients we're going to get, and we never know which interventions might be a great fit for them. And so I'm always willing to learn from interns who have a different theoretical orientation and are also able to bring specific skills that our patients might be able to benefit. Ultimately, my goal is to benefit my patients and to ease their stay. So I think that that's really all of the rundown for the burn ICU. If you're interested, I'm happy to answer any questions. And if you're also interested but just want to get a feel for what it's like to visit an intensive care unit, I'm happy to show anyone around and to discuss what that work looks like. Again, it's typically doing like an initial interview and assessment, and then oftentimes brief follow-up interventions, so between 15 and 30-minute brief follow-up interventions with patients to just check in. We work very closely with the psychiatry team, so you can learn a lot about medications and what psychiatry looks like. They're a very welcoming group and are very excited to have a psychologist on board. And then also, too, we do some brief assessments with patients, and we're looking to expand that assessment. So anyone with assessment experience or looking to get experience of assessment with an inpatient population or intensive care population, I would welcome that as well. It's not uncommon for us to have non-English speaking patients, and so anyone who has a clinical competency for any other language, I'd obviously welcome that. And we serve a very diverse population, and that oftentimes can be a barrier to patient care upon follow-up, and so sometimes those patients stay with us longer. And in that case, it's a great opportunity to really build close relationships and really be able to represent how much a psychologist can really support a diverse group of people. So if you have any interest, feel free to email me or call, and if you'd like to set up a meeting to discuss what a minor rotation might look like on the burn ICU, I'd be happy to talk.